common question we get here at the office from my patients with low back pain is, do you think my hip flexors are tight? A lot of times when my patients come in, they've been told by a massage therapist or maybe their trainer that, man, you have really tight hip flexors. I bet that's part of the problem with your low back. This can be confusing for people because they don't really know what a hip flexor is, and they don't really understand it, or maybe they've never done any testing to see if their hip flexors are part of the problem. Now, in regards to hip flexors, they're muscles that sit deep inside this area of the pelvis, and they actually are on the backside and they connect into the spine. And essentially what they do is they bring your knee or your hip into flexion, bringing your knee up from the ground in this scenario and shortening this area from here to here. And if they get tight, what they do is they cause this anterior forward tilt in the low back, and they cause extra stress on the joints in your low back, but also extra work for these muscles through here. And it can actually lead to some pretty stubborn back pain. Today, what I'm going to show you is how to determine whether or not your hip flexors are actually part of the problem and or are they actually tight. So what we do to assess this in the office is we do what's called a Thomas test. So what I'll have the patients do is they're going to sit at the edge of the table. Now you can do this at home with anything to where your feet would hang off. So you probably don't have a massage table, but you could try this on your dining room table or anything that's high enough off the ground to where your legs aren't touching the ground. And what I have my patients do is they're going to lean back, grab one leg and bring that knee to the chest, and bring that to the chest as their back flattens against the table. So right now what I'd be looking for is, where is this leg? So this opposite leg that you see here is still lying on the table and my back is completely flat against it. So that would tell me that my hip flexors are not part of the problem in this case, or not necessarily shortened and tight. However, if I was to do this and lean back, and as I come back, this leg hangs off the table, so there's space between this leg and the table. In other words, it's not all the way down. That would indicate that my hip flexor is tight. Now, the second part of this test that a lot of people miss is if I then manually straighten the person's leg and the knee comes down, that actually rules out the hip flexor, and it's actually an issue with a muscle called the rectus femoris, which is part of the quad. So the problem would be tension between the knee and this upper part of the hip, not necessarily in the hip flexor themselves. So again, the Thomas test, it's a quick, easy way to determine whether or not your hip flexors are actually really tight. So again, you're going to lean back, flatten your back against whatever you're laying on, and does this knee and leg just rest on whatever you're laying on once your back is flat and the knee is up, or does it hang up here? And if it does hang up here, what happens if someone straightens that leg? Does it stay up, above the table, or does it drop down? Those two things mean different things. One is tight hip flexors. The other thing is a tight portion of the quad. So what I'm going to do next is show you a stretch for either one of those two sections that you can do if this test is positive when you try it at home. Okay, so after we've performed the Thomas test and we found either one of two things, the hip flexors are tight or the quadricep or rectus femoris is tight, we want to show you some quick, easy stretches that anybody can do at home. So the first one of my favorite hip flexor stretches is just to be done in the kneeling position. So I've got a little knee pad there for my knee, and what you want to do is the side you're stretching is the knee down, and then you're going to get a nice straight posture, long spine, really tuck your chin here, have your chest, don't be slouched, be up straight. And then what we're going to do is slowly take that hip forward, keeping a nice tucked pelvis. So in other words, we don't want to be extended and leaning like this. If you just tuck the pelvis slightly into a neutral position and then stay upright as you come forward, that's a good stretch, and you're going to feel a lot of it right in through here. And we work out into that stretch, and then we can come back and rest and do that for 3 to 4 reps. Very easy stretch, really effective. Now, if your rectus femoris or your quad is tight, the easiest thing I have my patients do for that is the quad stretch in standing, which is one you've probably seen before. You're going to grab the leg you're stretching, bring that shoe or that foot to the butt, and then you want to bring that knee right here. It's resting here. My quad's actually tight. You want to bring it here to where it's underneath you, and then staying upright, you're going to work on bringing that knee behind you. Now, instead of feeling it here like I did on the last stretch, I'm now getting a big pull down further all the way to my knee as I bring that knee, staying upright behind me, bringing that knee behind me. And again, we're holding that for 20 to 30 seconds, working on 2 to 3, maybe 4 sets of that reps of that exercise. So these are really easy to do, but the most important thing you can do is determine which area is actually the culprit if you are really tight on this front anterior chain that could be contributing to your low back pain. So the quadricep stretch, hip flexor stretch, Thomas test to figure out which one you need. It's an easy thing to do at home. Hope this helps, and I'll talk to you soon.